This is the innovation project of the mobile app Simple Depression Test. The presentation is centered on how this simple app can help improve healthcare and empower stroke survivors. The mobile app Simple Depression Test could help people privately assess individual level of depression. What the app allows for is using it in the privacy of your own home. Assess their level of depression without having to discuss any personal problems with anyone, and seek help if needed. Depression continues to be a taboo topic in the public, which can make mobile apps a helpful tool to identify those who need intervention. Depression may affect anybody, from the rich to the poor, famous celebrities to lay persons, and successful to unsuccessful individuals. In 2018, Anthony Bourdain, a celebrity chef, committed suicide at age 61, and Kate Spade, a designer, committed suicide at age 55. The reasons these successful celebrities committed suicide has no definite cause, but one could say that their suicides may have been prevented if they spoke to someone close to them or a healthcare provider regarding their struggles. Major depressive disorder affects as many as 16.1 million Americans per year, making depression the leading cause of disability in people ages 15 to 44. The rates of depression increase significantly when dealing with any hardships. Doctors' offices, especially primary care providers, are usually the place where a depression scale is used to measure severity of depression. With limited and overcrowded primary care offices, providers have limited times with each patient and may miss important opportunities for depression screening. A lack of diagnosis and limited mental health resources makes having depression difficult for many individuals. Background of the problem. Stroke is a life-changing event defined by the Center of Disease Control as a blockage in a blood vessel or a blood vessel that bursts in the brain. In the US, about 800,000 people are affected by stroke. In the first year, about one-third to one-half of patients who have had a stroke may develop depression. Depression may manifest in many different ways, such as inability to go to work, school, overeating, anorexia, insomnia, psychomotor retardation, somatic disorders, unexplained pain, anxiety, suicide, homicide, or social phobias. And this is not all. Depression is still underdetected and untreated in 50 to 80% of stroke patients by providers who have no psychiatric training. Depression can be detrimental to recovery of stroke patients because it is linked to a lack of participation in therapy and impaired cognition. The research by Kleindes, Clark, and Dunbar set out to identify if stroke patients would discuss their depression with the primary care provider. The research shows that many patients did not report depression because they thought their mood was related to old age or a physical problem after the stroke. The research concludes that there needs to be increased depression education to help patients identify early signs and symptoms of depression, which would only benefit the patient's recovery. Stiles, Shields, and Montague completed a pilot trial that concludes depression apps will help remove some barriers to depression screening. Such as previously discussed. Innovative collaboration were completed with 3 nurses. Jennifer is an inpatient oncology provider for 5 years. She finds that initial cancer diagnosis is overwhelming for patients, and they would not be able to answer a PHQ-9. The FNP states that the simplicity of the simple depression test may be appropriate for her patients. For herself, she was quick to say that she'd rather use a mobile app before discussing any depression with a healthcare provider, and she will only do so if necessary. She states that being a provider, she is reluctant to immediately seek help because of privacy concerns. Antoinette, a case manager who handles many occupational health injury cases, reports that her position with long-term clients allows her to build strong relationships, and they are usually the first to tell her if they need any mental health services. She reports that the mobile app may be helpful for having a strong rapport with patients, and that allows for greater honesty. Stephanie is RN in the emergency room as an informatics specialist. She has been an RN for over 25 years and find a mobile app to be impersonal and may report inaccurate data. The RN also reports that in the computer charting system, it offers a PHQ-9 evaluation for all stroke patients, which is part of the stroke protocol, but is generally not used for all patients. Utilization of appropriate technology includes educating the patient as well as the caregiver regarding the early signs and symptoms of depression, completing initial PHQ questionnaire with the patient to familiarize them with the types of questions that they are expected to answer, and compare results at future visits. Also, the provider can help to download the mobile app for patients at the time of discharge from hospital or at the first follow-up appointment. The app icon is the one listed on the right. And after downloading the app, they can complete the test on the patient's phone with them prior to leaving the office to engage the patient about the ease of use to answer these questions. And most importantly, to encourage the patient to self-report all their depression scores to their primary doctor to assist in their own care and help providers with their depression. Utilizing the Simple Depression app, there are 10 main questions that are based on the PHQ-9. And as a patient reads through the questions, they submit the answer by choosing one of those 4 options. If a person would like all the questions on one page, that option is also available. Once all questions are answered, the app gives personal results with a score of 0 to 27. The range is 0 to 4 is minimal or no depression, 5 to 9 is mild depression, 10 to 14 is moderate depression, 15 to 19 is moderately severe depression, and 20 to 27 is severe depression. The information provided will help individuals assess their own level of depression and prompt them to seek care from a primary provider. Innovative solutions includes the development of new ideas to allow open communication with patients and healthcare providers, using the mobile app to impact change through simple depression tests. For example, the healthcare provider will be the experienced architect who will help to create an experience for the patient by setting up their mobile phone with the app so that they can easily go to it and use it. Collaboration among patients and medical providers will empower patients to be part of their own healthcare team, meaning all patients, along with their providers, use a collaborative approach to treating their depression or their symptoms of strokes. The app will also open up lines of communication among the patients and their own family members. This will only help to empower patients and caregivers to speak up if they are depressed or if they witness any depression in their loved ones.